Hi, I'm Tom Field, Senior Vice President of Editorial with Information Security Media Group. Welcome to today's session entitled How Tri-Counties Regional Center Secures Sensitive Files and Maintains HIPAA Compliance. Your speaker today is Dominic Namnath. He's Chief Information Officer with Tri-Counties Regional Center. And before I turn this over to him, I want to give you a bit of background on today's session. Guided by a human-centered principle, there is nothing more critical to California's Tri-Counties Regional Center than protecting and promoting the lives of those with developmental disabilities. That is why Tri-Counties proactively secures personal health information to protect the people behind that information. Critical to this initiative was the ability to secure sensitive information shared through cloud collaboration and to comply with government regulations such as HIPAA. This webinar today will explore the nature of file security and how you can quickly and easily secure sensitive data containing PII and PHI spread over a variety of systems. Tri-Counties will further explain how it leverages Vera for a single, seamless solution to persistently protect their patients' information. In this session today, Dominic will teach you how to use cloud collaboration tools such as Box without losing control over sensitive files. He'll demonstrate security and audit of PHI to comply with strict HIPAA regulations, and also demonstrate how to prevent unauthorized distribution of information perpetuated by authorized recipients. Just a bit about my organization, Information Security Media Group. We currently publish more than 24 international media sites. We have Bank Info Security and CU Info Security for financial services, Gov Info Security for the public sector, and Healthcare Info Security for the medical community. We also publish Info Risk Today about information risk management, Data Breach Today about breach prevention and response, and Careers Info Security. Each of these sites is dedicated to providing education and news regarding information security, but specifically tailored to their individual sectors. With over 750,000 members registered to our sites, we've created a true information source that tackles the key issues of interest to our unique audience. Just a few notes of housekeeping, please. If you have any questions for Dominic during the course of his session, please submit them via the chat window that you see on your screen. If anyone should experience technical issues while viewing today's webinar, then please dial the number that you also see on your screen. If you dial extension 115, we do have technical support staff standing by to help. Also, I do need to emphasize, the content being presented in today's webinar is copyrighted material. As such, it's meant for today's session and individual study purposes only. If you or your organization would like to use any of the information presented in today's session, or if you're looking for customized training materials, please contact us. And it's my pleasure to introduce our sponsor today, Vera. Vera is the security platform chosen by the Fortune 500 to secure, to track, and control sensitive information that needs to be shared externally. With a keen focus on the user experience for employees and security pros alike, Vera can protect any kind of information, no matter how it's stored or shared, anywhere it travels without affecting how work gets done. With robust policy enforcement, strong encryption, and strict access control, Vera's data-centric security solution enables teams to collaborate freely while ensuring the highest levels of security, visibility, and control. To learn more, please visit www.vera.com. And it's my pleasure now to introduce our speaker today, Dominic Namnath. Again, he's the CIO, Security Officer, and HIPAA Compliance Officer for Tri-Counties Regional Center. Tri-Counties is a $300 million private nonprofit organization contracted to the California Department of Developmental Services to support and provide services for 13,000 plus people with developmental disabilities in Ventura, Santa Barbara, and San Luis Obispo counties. Tri-Counties is one of 21 regional in California, supporting more than 270,000 people with developmental disabilities. Prior to Tri-Counties, Dominic spent 12 years at EDS, working in account management, infrastructure, systems integrations, process automation, and support services for companies such as Xerox, Hitachi Data Systems, Levi Strauss, The Gap, and Delco Systems. With that, let me turn this over now to Dominic. Dominic, it's all yours.
Thank you, Tom. It's really kind of interesting hearing your resume on a webinar, but thank you very much for that introduction. I want to give you some background or just go through the agenda real quick. Hold on, I'm going to wait for my control. Okay, so this is the agenda. We'll go through this rather quickly. I will be speaking rather quickly to get through this information. I don't want to keep you too long. And again, if you have any questions, please put them in the message box and I'll try to get to those at the end. So Tri-County's background, you know, we are very much involved in this person-centered principle to ensure that we're making the best effort to understand what's important to people versus what's important for them. You know, in a lot of the work that we do, we deal with medical professionals and other types of professionals, and they have this intrinsic way of talking to people and telling them what's important for them to do. And we don't want to do that. We want to be more active as far as listening and understanding what people are wanting out of their services and what their personal goals are. One of the things that we do know for sure is providing services faster is something that's very important to us, and it's very important to people with developmental disabilities and their families. One of the things that we've been able to accomplish through our digital transformation, that we have been able to improve our delivery time for services from approximately 3 to 5 weeks for services to today, where we can deliver services basically faster than Amazon Prime. In many cases, services begin tomorrow. So you can imagine if you're a family with someone with developmental disabilities, the difference between starting a service tomorrow versus next month sometime. So that's something that's very important to us, and part of why we have the technology stack that we use is to provide our folks that work for us, that provide the services, basically a safety net that says that you can work in your natural methodology, and if something were to happen, then we got you. We can take care of any kind of problems that may occur as far as any kind of data breaches or any kind of mistakes that may occur. So the information that we have, is very private. There's a lot of medical information, there's diagnosis information, there's treatment information, and there's actually people's thoughts and ideas about what they want to do. Our use of Box and DocuSign and Vera and some other tools really stresses, the importance of keeping this stuff secure. As fast as we can deliver services, information can also get out there just as fast. And so we want to make sure that we control that information, and if something were to happen, that we can repair that information. We can repair the breach and take care of the files that are out. We owe it to the people that we serve, and we owe it to our staff to be able to provide that environment for them. Some of the main challenges, probably the first challenge is that we had to come up with a way to allow our staff to collaborate with the families and the service providers in such a way that there's not this additional burden of using cloud-based services and inadvertently letting that information out. So we had to make sure that we protected that part of the process. And of course, with HIPAA, we have to be able, to protect the information when it's at rest and when it's in transit. That's the easy part. There's probably nothing easier than, putting something up in the cloud and, they handle all the encryption and the transport and all that kind of stuff. The problem is that what happens if something were to get out? And if you get audited, you're required to create a backlog of, or a background audit of who got those files and what they did with those going back 6 years. Without the tools that we have, without Vera and without Box, we would be doing that anecdotally, and we would have to somehow reconstruct where those files went and how it would take much longer than it takes today. So being able to monitor and audit the movement of files is critically important if you were to have some kind of a violation. The other part of it, and this is one of the things that's probably the hardest to manage is, if information gets out there, what do you do? The unauthorized distribution, happens in many forms, but probably the biggest threat is, a rogue employee or an accident of some sort, or somebody accidentally shared an entire, folder structure with people that aren't supposed to see it, or perhaps replying all and throwing a file inside of there to 40 people, and only one person is supposed to get it, and then you're kind of in a pickle there. And so with Vera, we're able to take care of that. So the next stage of what's going on with us is to understand the impacts of what could possibly happen. Last year, one of our only hospital here in Santa Barbara, California, that levied the largest fine because of a HIPAA violation. It was $3.2 or $4 million. And that's a huge amount of money for us as a private nonprofit. That would come directly out of our administrative funding and really impact quite a bit of things. And in addition, the loss of time and productivity, if we have to do an anecdotal audit of where these files went, it sounds like a trivial thing, but when we're working with, almost 3 terabytes of data and, I think we're about 17 million different files, it could really be quite a headache. So the effort that we put into doing this, we didn't want to cause or add additional steps that were not natural workflow types of things. And so we wanted to make sure that everything flowed as normally and naturally as possible for our end user and our staff. And then the recipients of these files using Vera would have a user experience that's no different than what they're used to. So how we did it, there's a couple of challenges in this type of approach with the file-based system. One of the things was we wanted to make sure that we got a system that would work in the background. So with Vera, the way that the files are encrypted or protected, really, because I don't think it's quite an encryption process, is that the files that are put into the folder structures that are defined as protected within Box are linked to Vera. And as files go in there, they're transformed into a Vera protected file. That way, our staff don't have to do anything different than what they're doing today. They're using the same folders they did before we implemented Vera, and they're using the same folder structure today. And they share the files as they did before. So keeping the structure based on the files and the data, and keeping the protection in that level allowed us to just move forward with this whole initiative, get the files protected, have the protection outside the organization, have the utility to be able to respond to an audit if it were to occur. It became a seamless operation as far as our staff goes and as far as the IT staff goes here. So that really lent itself very well to us. So again, it's automatic. We don't have to really do anything other than set it up, monitor it a little bit. Here's a little graphic of what happens. Like I said, the data is basically just dragged into Box, or however our information goes into through email attachments or whatnot, or automated processes. And it just goes right into Box, and we use the same sharing methods that we do now, and everything gets taken care of. It's seamless. People have adopted it very easily, both internally and external collaborators. And so we're very happy with that, and staff were very happy with that. The ability to track the files is actually very cool because we can do it in a number of different ways. The first and simplest way is to just use the box native tools and go in and take a look at the permissions and the activities of the files. And in the Vera methodology, we can go into the Vera administration screen and take a look at the files or the folders or the users, which is really kind of cool, because if we had a situation where one user, sent out hundreds or thousands of files inadvertently, we can just go by the user, go by a date and say, take all of these files and cut the access to those files, and we're done. If we need to do an audit report, we just go to the user or go to the folder or the file, and we can take a look at that, export the report on who accessed it, when, and what they did, copied it, printed it, those kinds of things. And in addition, with the permission sets that Vera allows you to have, we can prevent people from printing the file. We can prevent people from viewing the file on the screen and limit it to 4 lines at a time. So it makes it a little bit more difficult to do screen captures and things like that. So there's that level of security. We don't quite get into that level of it, but we could if we wanted to. The really tricky thing about Vera, and probably the thing that blows people's mind the most, is that once the file leaves us as either an attachment or as a link through Box, and somebody were to download that file and put that file on their local machine and maybe send it to somebody else, the idea that we can revoke and prevent that file from being viewed further down the chain is always something that's kind of interesting. And I really can't tell you how many times I've had to prove to people that it actually works. That is what protects us. It protects staff when they see that it's possible. It's not like the wild, wild west for them and they just go crazy and send files everywhere. But they do have that safety net so that when they send something through DocuSign, when they send, a link to a type of a contract for people to work on and work with, that these files are protected, and the people that we serve know that these files are protected, and they have confidence in what we're doing and the way we run, our show. The overall idea behind Vera and us is that we have this safety net for our staff, and we owe it to our staff to protect them in such a way that they can get their work done, get it done efficiently, and know that if something were to happen, if something were to go sideways on them, accidentally or on purpose, that we have this fallback position. Now that was pretty quick, but Vera is really a very highly technical solution, but it's very easy to explain, and it's very easy to deploy and get people using it. So we're not going to sit here for hours on end talking about how it happens. It just sort of happens. So really, that's it for me on what we've done. We've been using Vera now for about a year and a half. It's been very successful. We've been able to work through a lot of the changes. Vera is very good about the updates and listening to some of the needs that we have. And I think they've addressed all of our needs. And so they're very responsive. And we have had great success with it. Tom, do you have any questions?
In fact, I do. And I want to remind the attendees, if they have questions, they can send them along now. Do it by the chat window. We won't have time to get to every question, but for those questions we don't answer in this session, we will respond to via email. Dominic, first question I have for you is the one you always ask a CIO or a CISO. How did the adoption actually go? What were maybe some of the speed bumps you encountered along the way, and what you would advise people to do under similar circumstances?
Yeah, that's a really good question, and it does come up. The adoption in a broad picture, it went very well, but there were some very interesting dialogues that occurred between the time that we began testing and we proposed, and then we went through our internal testing. The first one, I mentioned it a little bit, is people didn't believe it worked. Was the first thing. We would send these files out. and they would test it themselves. They would copy these files or send it to their personal email, and then they would open it up and they say, aha, look, I can open this thing. That's not a problem. And then, showing them that, hey, from this console, I can kill that file. And then they try to open it like immediately, and it's not opening. And it's like, what the heck? How did that just happen? And then you show them that, and then the next level is, well, what if I sent this out to 10 people? You have to go to 10 different people and kill that. I go, no, I can just kill it from one you sent. And so by proving that the system works the way it was designed, getting over that sort of this illusion that it's all magic kind of thing was probably the first part of it. Then when we went to deploy and staff, we had a little demonstration of how this worked. They were still sort of scratching their head. And then, the questions would come up. It's like, well, how do we use it? And it's like, well, you do exactly what you're doing. It's just know that you have to communicate to the recipient and let them know that there's an authentication step that they need to perform in order to view the files. No different than like an encrypted email or something. But once they got over that hump, and it was a small bump in the road for them, they were just off and running. And the other part of that is the sophistication of our users. Nothing against social workers, but they're not technically inclined, and they were able to adopt to it very quickly. And even the folks that we serve, some with developmental disabilities and the families, not only were they appreciative that we are protecting their files, but they were able to interact with the system pretty seamlessly. So it went very well.
Dominic, most important follow-up question. Have you had to use Vera yet?
We did. It was kind of an interesting situation. We get subpoenaed for certain records sometimes, and we have to lock the records to prevent people from changing it and modifying it or even looking at the records. And so we create these folders that help us do that, where any kind of subpoenaed records go into this file, and we can lock people out. Even people that own the file themselves, through Vera, that added layer that sits on top of the regular file permissions, we can prevent people from going into it. And even if they attempt to open the file, we can see that they've attempted it. And the judges were pretty impressed that we can lock those things down and ensure them that there's been no changes made to somebody's document. And we've had other instances where somebody just mistakenly sends a file to the wrong doctor with the same name, basically, but they sent it to the wrong doctor, and we just kill the file. And then that doctor that received it can't open the file, and they immediately call us up and go, hey, how'd you do that? So that was pretty cool. And we haven't done the auditing yet. I do drills every now and then where I train my staff on how to pull the audit reports. And pretty much anyone on my staff can pull a complete audit report going back 6 years on any one of our caseload files. And it takes probably start to finish under 30 seconds. And so in those cases, it's actually been really cool. And it's another safety net for my IT staff, so that if they're requesting an audit report, then it's not a burden to them to create those reports.
Well, Dominic, we're getting lots of questions, and of course, we won't be able to get to every one of them, but I want to get a couple of them in here. One question, is Vera used for data within applications or just at a file level?
For us, it's at the file level. It's not going to protect, like you would protect like a spreadsheet kind of a thing. You can't open that file. If you want to lock it down, you can't open it. You can do that. If you want to make it so they can't print, they can do that. Those kinds of things. So yeah, it's file-based, strictly file-based as far as I know.
One more question for you. There's recent news about Box that you probably have seen. With an incident like that, would Vera remedy it?
Oh God, I knew you were going to ask me something about that. Yeah, the recent news that there's a potential problem with Box, where if permissions are set or not set to be internal staff only, so it's only the people with the domain name, your email domain name, can access the files. There's a potential that there are ways that hackers could come in and just start using like a dictionary hack to try to find folders that are open to the public and then download those files. And so most definitely if that were to happen to us and somebody downloaded an entire folder or a folder structure of files in that method, I'll know it because of the tools that are built into Box that said that, hey, there's this weird download that instead of just being sort of in California, which would be normal, is that, maybe, hey, someone from Kansas downloaded all these files. At that point, I can go into Vera and, point to that folder and go, hey, lock down those files. And so when the person is finished, with their pizza and they get all those files, they're going to go to open them and they're not going to open. So yes, definitely, if that were to happen to us, I would kind of have this sort of, sly grin on my face and be like, yeah, no problem. Big problem for Box, but not a problem for us.
Very good, Dominic. I appreciate your time and insight today. Thank you for sharing your story and for taking time to answer these questions as well.
My pleasure, Tom.
Of course, I want to thank our attendees also. They took time out of their day to attend this session. And I do trust that your story, the discussion, provided some valuable new insight to enable them to be able to be even better prepared to tackle protection of sensitive data in their own organizations. I do look forward to seeing you each at our upcoming events. Until then, for Information Security Media Group, I'm Tom Field. Thank you very much.